Hi and welcome back to CareSync Experts. If you're a healthcare provider preparing for your next CQC assessment, this video is for you. Today we're breaking down the 6 evidence categories in the new CQC Single Assessment Framework. We'll keep it simple, clear and practical so you know exactly what to expect and how to prepare. Let's get started. So what are these 6 categories, you may ask? Well, under the new CQC framework, inspectors gather evidence from the 6 key categories to understand the quality of care you provide. These categories ensure that assessments are consistent, fair, and focused on what really matters: the experiences of people receiving care. So here they are. Number 1 is people's experiences. 2 is feedback from staff and leaders. Number 3 is observations of care. 4 is feedback from partners. 5 is processes, and 6 is outcomes of care. So let's break each one down. Firstly, let's discuss people's experiences. This is the heart of the assessment. The CQC wants to hear directly from the people who use your services, as well as their families and advocates. They gather feedback through interviews, surveys, emails, and even phone calls. Their focus? Real stories about care experiences. Next is feedback from staff and leaders. The CQC collects feedback from your team, both frontline staff and leadership. This includes staff surveys, focus groups, interviews, and even whistleblowing reports. They want to understand workplace cultures, leadership effectiveness, and the team's dynamic. Next is observations of care. Inspectors will observe care firsthand. They watch how staff interact with service users, how dignity and respect are maintained, and the overall environment of care. Remember, observations can happen without prior notice, especially if concerns have been raised. Next is feedback from partners. The CQC also speaks with external partners like local authorities, healthcare professionals, and other agencies you collaborate with regularly. This helps paint a full picture of your service's reputation and effectiveness in multi-agency work. Next is processes. Processes refer to your internal systems, such as policies, procedures, audits, and governance structures. The CQC reviews these to see how well your service operates behind the scenes, including incident management, safeguarding processes, and clinical governance, but most importantly, ensuring that your staff are aware of the correct procedures and policies to follow when these do occur. And finally, outcomes of care measure the actual impact of care on individuals. Are service users healthier? Are they safer and happier because of your support? This includes data like health outcomes, readmission rates, infection control, and personal progress stories. To sum it all up, the CQC's new framework is all about understanding the full picture of care, from policies and staff feedback to the actual experiences of people receiving support. Remember, evidence comes from multiple sources. Inspections can be on-site or remote, and feedback from service users and staff holds more weight than ever. So keep your processes strong, engage your staff, and make sure your service users' voices are heard.